agencies to assemble a report assessing the effects of the American Health Care Act on Oregonians and on Oregon. And you've now got the report that we've compiled. We'll make a few comments about impacts from each of our agencies' specific perspectives, and I'll turn it over to Lynne Saxton with OHA.
Great, thank you, Lynne Saxton, OHA, and I'm pleased to have my colleagues here today, because I think what we've tried to do in this report is to carefully outline what is known right now about the legislation that is pending, and to be really clear about impacts on Oregonians. Our teams have gone to great kind of analytical lengths to clarify what the gains are from the AHCA and what the losses are in the ACA in terms of how those changes affect Oregonians, how they affect the healthcare system that we have been building in Oregon for over 2 decades now, 3 decades. I think from the perspective of Medicaid health and public health, which are 2 of the portfolios within the Oregon Health Authority, our analysis is that as many as 465,000 Oregonians will lose health coverage between 2018 and 2023, including approximately 80,000 next year. The fiscal impact of that is a cumulative cost shift of about $2.6 billion over the next 6 years. One of the things that we have included in the report that I'd encourage you to look through is to really break down the impacts on economic sectors, on the health system, on individual Oregonians, on the impact of the tiering proposal, which is in the legislation, TIER-ING, which we're concerned has an impact on older Oregonians, many of whom post the Great Recession of 2008-2009 are struggling to get to Medicare age before they have to access public benefits. So I would also just note the reduced economic impact, economic activity as a result. Our estimate is the HCA could result in as many as 23,000 healthcare jobs. Those jobs have been evolving over the last 3 years as the Affordable Care Act has been implemented. Also want to underscore that our staff did an excellent job working on very short notice. Our goal here is to inform people. Put quite simply, our phones have been ringing a great deal. People have questions, and our responsibility as an agency is to provide clear and concise public information of what is known now, and we'll continue to do that in the weeks ahead.
Okay, so thank you. I'm Clyde Psyche. I'm the Director of the Department of Human Services, and this is actually Preston Cottingham, who is the Director of our Aging and People with Disabilities program. So the impact on DHS is primarily through the Community First Choice option, or what is commonly known as a K plan. This is the part of the ACA that provided an additional 6% of federal funding over our typical Medicaid match rate to serve people in our Aging and People with Disabilities program, and our program which serves people with intellectual and developmental